10 hidden signs your body is trying to warn you about your health. We install alarm systems to warn us of intruders trying to enter our houses. Computers and cell phones have warning systems to tell us our batteries are running low. Even our bodies have warning systems to tell us that there is something wrong. Yet we often do not recognize these warning signs. The problem is that if we ignore these signs, we may become seriously ill. Rather, pay attention to these signs and save yourself from serious illness and potential premature death. These are 10 hidden signs to be on the lookout for. Skin problems. Like our eyes, our skin is an early indicator that there's something off in the body. Whether it's dryness, breakouts, or even excessive wrinkles, the skin is an excellent indicator of wellness. Being the largest organ in the body, it's easy to detect changes and problems. A skin rash, accompanied by joint and muscle pain and fever, can be an indication of an infection. Yellow skin is immediately associated with problems in the liver. Hardened arteries could become more visible under the skin, warning you of the risk of heart problems. Hormonal disorders often show up in breakouts, while dry and itchy skin can also be attributed to hormones. Swollen and hardened skin may indicate the presence of an autoimmune disease. Increased thirst for water. Out of the blue, your mouth feels dry and you're increasingly thirsty all the time, not because it's necessarily a hot day and you have sweated a lot. When there's a sudden onset of an increased demand for water, the body may be telling you to check for diabetes. When accompanied by blurred vision, increased hunger and fatigue, it's a matter of urgency that you ask your daughter to test you for any signs of diabetes. Body temperature fluctuations. A normal, healthy body temperature is about 37 degrees Celsius. When your body exceeds this measurement, it's usually an indication of fever. Although minor fluctuations are normal, excessive changes can be an indication of conditions such as hypothyroidism, septicemia or bacterial infection, adrenal fatigue, and even altered insulin activity in the body. A body on fire always needs intervention. Weakness in the legs and arms. When you start feeling fatigued and weary, and the feeling is not due to hard physical work or overexertion, you should look for the source. A lack of energy can be caused by underlying conditions such as malnutrition, nerve impingement, electrolyte imbalances, as well as malignant tumors or congenital myopathies. Better be safe than sorry. If you feel concerned, react and consult your medical expert. Bloatedness and stomach pain. Indigestion, allergies, and bacterial infections are but a few reasons for stomach pain and cramps. Drinking contaminated water can cause serious problems. Although these conditions don't sound so serious, they can cause great harm to the body. However, stomach cramps can also occur during a heart attack. Those who often suffer from abdominal pains while always feeling bloated with episodes of diarrhea might be suffering from irritable bowel syndrome. Sudden, unexpected weight loss. When you start losing weight without trying, it may sound like a blessing in disguise, but don't be fooled. Drastically losing weight is always a reason for concern. When you lose 10 pounds or more without doing exercise or changing your diet, it's time to consult your doctor. If your diet hasn't changed significantly, it may be attributed to an underlying medical condition. An overactive thyroid is responsible for unintentional weight loss. The list of conditions that should be considered when a person suddenly loses weight is quite long. It could be rheumatoid arthritis, diabetes, depression, tuberculosis, or even cancer. Let your doctor check you out for stomach cancer, especially when you have a loss of appetite. Sleep cycle issues. Sleep problems may vary from sleeping poorly, sleeping too little, or sleeping too much. Various health problems are closely related to sleep disturbances. Sleeplessness or insomnia is a common symptom of mental health disorders, which include phobias, panic attacks, and anxiety, depression, bipolar disorder, and even schizophrenia. Brain and nerve disorders like dementia and Parkinson's disease are also prone to cause sleeplessness. General sleep problems can be indicative of diseases like heart failure, musculoskeletal disorders, thyroid disease, as well as kidney disease. Frequent urinating. If you all of a sudden start struggling with frequent urination, it's time to go for a checkup. As a defense strategy, Your body may try to eliminate too much sugar in your blood. This happens when a person's body has trouble breaking down food into sugar, a clear sign of type 2 diabetes that may be developing. If you have always been a lazy water consumer and you've upped your intake to the recommended 2 liters per day, of course, this is just a healthy way of the body cleaning itself. A bladder infection or urinary tract infection usually also causes more frequent urination. Although this is not a long-term disease, it's surely worth checking out. A foggy or cloudy mind. Most of us realize that our physical and mental health are integrally connected. Just as mental and cognitive health problems can affect your body, the opposite is true. A cloudy mind that all of a sudden struggles to formulate ideas or to structure thoughts should be an indication that your body is crying out for help. Take note that some medications may have similar effects on your emotional state. Consult your physician or read the information on the pamphlets if you suspect that medicine may have an influence. Chest pains. If you experience any kind of chest pain, you should never ignore it. Get immediate medical attention. Ignorance will not be bliss. Chest pain is a common symptom of a potential heart attack, but if it is accompanied by nausea, shortness of breath, dizziness, cold sweats, and any type of pain or numbness, it's time to get to an emergency room. Chest pain can also be caused by a panic attack, pneumonia, or even pancreatitis. As a point of departure, it's important to pay attention to what your body is telling you. For this to happen, you should know your body well. Know when there's a short-term symptom and try to identify the cause. When a symptom persists stubbornly, it's time to take action. By reacting to these early warning signs, you can save your own life or that of a loved one. Don't be ignorant. Your life is precious. Let us know what you have taken from today's video. Are you personally concerned about any of these 10 warning signs? Subscribe to our channel today and hit the notification bell to be informed the moment we release new content. We appreciate your continued support.